right. Wonderful. So we have started our live stream and recording. Again, my name is Liz Woodward from the Maryland Department of Aging, and I'm going to pass it over to Pazit Aviv, our chair, to get us started. And Pazit, let me know if you want me to pull up the agenda as you're talking.
I think for the introduction, we're going to see each other's faces more than the document itself. It makes more sense. And then if we need to, we can refer to the agenda item as we move through the time. So, hi everyone, my name is Pazit Aviv. I work for Montgomery County Aging and Disability Services, and this is our inaugural Longevity Ready Ecosystem Workgroup. That's a mouthful, so we're going to have to parse that out and make sense of what that actually means for all of us. So for our introduction, I thought that just to get to know one another, there are two ways we can do that. The first one is a document that had been shared with you all, where you can add a little paragraph about yourself so that we have a better sense of who is in the group. And if you haven't done so, if you have challenges finding that's easily, help is easily available with Liz and Chelsea. But secondly, we can just all go around, say our names. And so once you say your name, you can just say one thing that brings you joy. I do hope there's more than one thing that brings you joy, but just pick one for today. Maybe we'll do every meeting start with joyous exchanges. But once you've said that, just a quick sentence, pass it on to whoever you see on your screen until we are done with everyone. So the thing that brings me joy is writing, just fiction writing. Okay, I see Catherine.
Hi, Kathy Shea. I just retired a week ago, so here I am ready to jump into something new. But the thing that brings me joy is being at the beach, and that's why I chose this scene. And so I would bring in Sean then.
My name is Sean Brennan, Montgomery County, age-friendly program manager. And what brings me joy is walking outside in the woods with friends. And I would like to select Anne Fleshman.
Hi, Anne here. Retired and enjoying every minute of it. And gardening brings me joy. And we'll go over to Charles.
I'm Chuck Kaufman. I served on the Commission on Aging, and I'm currently on several boards, including the Visitors Bureau in Montgomery County, Human Rights, Friends of the Human Rights Commission, Taxi Cab Services Commission, and a few others I can't remember. What gives me joy? Family. I think as you get older, your family is probably the most important thing in your life, and be good to your family. Make up with your sisters and brothers, because you'll regret any differences you've had later on in life when you guys get older. Yes. And I think, let me see. Sean, you've been on. Anne, have you been on yet? Anne Fleshman.
Yes, I've been on. I can just look at the list here.
Let's see.
So
Pick
with
a
Marcia,
name.
I think is next. Marcia
Good.
Prusen.
Oh yeah, Marcia, of course.
Good morning, everybody. I'm Marcia Prusen. I've had a long career in aging issues with the National Institute on Aging and with Montgomery County. I was on the Commission on Aging also, and continue to stay involved with it 20 years later. And I was the former age-friendly program manager before Sean. And I'm delighted to be here. Oh, what makes me happy? Staying engaged and playing with my grandkids.
You want to pass it on to somebody?
Oh, let's see. I'm trying to see who I can't see what the list is. And
okay, I'll take it. To make it easy for you guys, I'm going to call on people because I don't want to waste time.
All right.
Israel Cross.
Hi, Israel Cross. Maryland native, born and raised, educated, teach or taught in the United States Public Health Service. I'm the only gerontologist out of our service of about 6,000 officers. Also the president of the National Aging in Place Council, caregiver twice over. So what brings me joy is family and exercise.
Awesome. Carol Lienhard.
Carol, you're on mute.
Carol, you're absolutely right. I'm on mute. Delighted to be here. My name is Carol Lienhard, and I'm the retired director of the Harford County Office on Aging. I'm a past president of the Maryland Association of Area Agencies on Aging, and currently I co-chair the Maryland Senior Citizens Action Network. I've been retired for 20 years, and as Marcia said, staying engaged is one of the really important things for me. I'm 80 years old. I'm a caregiver, and I serve on boards of a number of our local low-income housing, one of our nursing homes, and I love staying engaged and being able to continue to contribute.
Good morning. My name is Steve Gale. I am with the Option Group, care managers and advocates. And what brings me joy, my son's 8. I'm in the 3rd grade this year. I've just seen him kind of come into his own, coach his teams. That brings me a lot of joy. He's also turning into a big Orioles fan, so that brings me even more joy here lately. And I'm happy to be here.
Jane Road.
Hi, my name is Jane Rohde, and so Carol, you don't probably remember me, but we worked on Harford Renaissance Village like a gazillion years ago when I first started my career. So it's very nice to see you and see how engaged you still are. I have a architecture practice that's been in the design space for senior living since 1996. I worked at Erickson for 8 years prior to that. 5 years ago, we started a Live Together, which is a nonprofit organization focusing on intergenerational living. And Chelsea, I believe you were one of the students for Nancy Ginta, so from Frostburg, I think, right? Or did I have that wrong? Maybe I have that wrong. Okay.
I'm the program manager
that
worked with your students or worked with Nancy's students.
I knew there was a correlation. I was just trying to remember what it was. So thank you for that clarification. So in terms of joy, being an architect, but also working in intergenerational models, I love artwork and art and access to art because it gives people a lot of joy. And the Barnes Museum in Philadelphia is one of my absolute favorites. And I love to take friends and family there when I have the opportunity because it's such an alternative way of looking at how art can be assembled, and it is very architectural. But I've had the great pleasure of being able to share that experience with people. So if I'm in Philly at a conference, my office manager will say, "Are you in Philly? Did you sneak off to the Barnes?" so I kind of have a reputation for that. So thanks very much. Glad to be here. Thanks for the invitation to participate.
That's an excellent recommendation. I know what I'm going to do in Philly next. Marie.
Marie, we can't hear you, but I see that your mute is off, so you might want to check your microphone settings.
Better?
Better,
Yeah.
yes.
Okay. I don't know. Hi, everyone. Thank you so much for the invitation to be here. I'm Marie. I'm the founder of Wise Cities, which is a startup focused on supporting aging in place and reducing social isolation. I started this motivated by what I was seeing my grandfather go through, and I recently graduated from the University of Maryland a few months ago. And something that has always brought me joy, like as far back as I can remember, is listening to music in other languages, but then slowly figuring out over time what the lyrics mean by like learning bits and pieces of the language. Very good to meet you all.
Thank you, Marie. Ronald Johnson.
Hi, everyone. I am Ronald Johnson. I am retired. I'm a member of the Maryland Coalition on HIV and Aging, and I also serve as chair of the U.S. People Living with HIV Caucus. I retired as the Vice President of Policy of AIDS United, which is a national group. And although I'm right now in New Orleans, I live in Montgomery County, Silver Spring in particular.
Nice to meet a neighbor, Silver Springarian. How do you say that? Silver Springarian? I think I said it right. Steph.
Good morning, everyone. So delighted to be here with all of you. I am Steph Caridio. I'm with the Associated, which is the Jewish Federation in Baltimore, and I work on the Age Well Baltimore initiative. And something that brings me joy is being outside, especially in the summertime, and swimming as much as possible in those lovely outdoor pools.
Awesome. Stephanie. I'm so glad there's a Stephanie. I don't know what we would have done otherwise. This is awesome.
Hi, good morning. I'm Stephanie Archer-Smith. I am the Executive Director and CEO for Meals on Wheels in Central Maryland. I've been here for about 12 years. I always try to find joy in things and really enjoy life. So in no particular order, I get a lot of joy out of the work that I do. I also get joy from my family, my friends, outdoor activities, music, dancing. So trying to grab all I can grab, and delighted to be here today.
We have Yang.
My name is Yang Yu. I'm the Associate Dean of Liberal Studies at Howard Community College. I also serve as the chair of the Governor's Commission on Asian Pacific American Affairs. I also serve on Howard County AAPI Commission. Very honored to be here. What brings me joy is to spend time with my daughter and son. Thank you.
Kathy Martin.
Good morning. I'm Kathy Martin, Baltimore County. I've worked with numerous organizations that are multi-generational. My family, we all do lots of stuff together, multi-generational. So that's what I bring. My joy is being on the water or just being outside in general. So I'm outside now.
I think we've gone over everyone except Liz and Chelsea, and I do want you to, Linda. So let's go with Linda and then Liz and Chelsea to introduce yourself and to bring you doing. Linda, go ahead.
There we go. Good morning. My name is Linda Brogowski. I am a member of the Montgomery County Commission on Aging, retired health services researcher, but my career started out with the Baltimore County Department of Aging when it was first designated a AAA 1,001 years ago. And I also had a chance to work with Kathy Shea up in Frederick County, working with veterans. So I recognize a lot of names on this call. So it's good to have colleagues with such deep experience, such a breadth of experience. And what brings me joy is going to Camden Yards and seeing the Orioles beat the Yankees.
Lovely. Liz, do you want to introduce yourself more and just say what brings you joy? You are going to be with us, so you're it, man.
Sure. Okay. My name is Liz Woodward. I am the Assistant Secretary for Planning here at the Department of Aging. I've been here for several years across a couple of different roles and programs, and I'm really excited to see this process starting here. What brings me joy is being outside, especially in the fall as the leaves start to change and the weather's nice, and going on walks with my dog and my kids.
Last but definitely not least, Chelsea.
Hello, everyone. It's a pleasure bringing support for this endeavor. My name is Chelsea Wheeler. I am the program manager for supportive communities with the Department of Aging. I've been with the department for 3 years now. And what brings me joy, I would say eating. I love to eat and try new restaurants and new recipes.
That's fantastic. Okay, so we now have a much greater sense of who is in this space with us. Thank you all for joining. We're gonna go over to the next item on the agenda. If you wanna share the screen, whomever shares screens. I mean, I can.
I can do that. Okay. Let me bring it on over. All right, I'm going to share this screen. All right, can everybody see my screen?
Yep.
Wonderful. I'm gonna be a little bit bigger. Not that big.
Share the agenda first, too, so we'll see what's next. Or I can just say what's next on our agenda.
I don't know if I can.
Don't worry about it. I got it. So we are doing well with time. So now it's the portion of the meeting where we discuss like a meta conversation. This is going to be more of an intro session. So we need to talk about our structure, our purpose, and how we're going to do things, set some basic boundaries and guidelines so that we can all work together. I was telling Liz and Chelsea, there's a whole body of knowledge around groups and how they deliver. And so there's forming, storming, norming, and performing. We don't have time for all that. So we need to jump right in and do our best to find a way to work together and reach some good work product so we can give it back to MDOA. So the portion of the meeting right now is talk about our suggested timeliness of how we're going to deliver things in this very short period of time. We're going to talk about how we're going to constitute the work group, how we commit to it, and all these things. So jump right in.
Before we get into that, do we want to do the review of the charter as kind of a starting point?
Yeah, definitely. Do you want to share the screen? Yeah. So you all have received the resource packet, which is phenomenal, and I really encourage you to read it. Actually, if you read it carefully and see all the links there, it can get very overwhelming, but it's important to familiarize yourself with this document. Go ahead.
All right, so I'm just going to take you through it a little bit, what's here. And again, yeah, definitely take the time to look over it. So this is our resource packet. We think of it as sort of the thing we need to get started with this process, to talk about what we're doing here and what resources are available for you guys to do so. So we kind of have an overview of what we're aiming to do, a description of the goals. So you guys have seen this now. I'm sure you're really familiar in thinking about our goal, but as you can see, it also intersects with all of the other goal areas. So it's important to know what other work groups are going to be talking about, and that'll be part of our process. What do we focus on? What are other folks focused on? We've got the operational guidelines and sort of the responsibilities. Our defined goals and objectives, and our information and resources. Over here in this section, you can see our quick links. This first one is sort of the public facing, which means sort of our existing platform that's available for you. The rule of thumb is with our Google Drive, that's available to you guys to use, to store materials, to work together collaboratively. Anything that's in the final documents folder, that's what's available for the larger public to be able to see. Our completed meetings, meeting minutes, and meeting agendas. Everything that's in the working documents folder, things that you guys are maybe still drafting, working together on, and aren't ready to put out to receive feedback on just yet. We've got some additional resources, and we can add anything into this folder that you guys would recommend, and please do recommend. Say, I've got a resource that I think this group really needs to read based on our conversations. We have a recommendation template, which I'll pull up to show you what you are really responsible as a group for producing. That is what you will be producing. So some folks have asked us, am I going to have to put a bunch of narrative text together? No, that's not what we're tasking you guys with doing. We're tasking you with thinking through and developing recommendations that can be put into the Longevity Ready Maryland Plan. And we at the Department of Aging are kind of taking the lead on, taking our conversations and formulating them into narrative text. And then you'll be able to see the recorded videos and meetings. We know not everybody is going to be able to come to every meeting, but if you want to stay in the loop, you'll either be able to read what was in the meeting minutes once they are posted, or you can go and actually watch the recording of our meeting to stay informed. All right, so as you know, we are developing a multi-sector plan on aging. We are responsible for evaluating services, support, and care options to address the growing population of older adults in Maryland. And this plan that we're creating is going to serve as a blueprint for all sectors to transform the aging experience in Maryland through collaboration, partnership, strategic investments, and policy changes. And you can see here everything that we're responsible for doing per the executive order. And right where we are is really down here at number 4, identify goals with measurable outcomes necessary to implement the LRM initiative and include recommendations on. And these are all the things that are included in the executive order. Some of them are going to be relevant to this work group, and some of them might live in another work group. I'm sure you're familiar with our goals, and we have them kind of highlighted right here. We also have our timeline highlighted. We are kind of over here, right? We're here in September launching our work groups. We're going to be working on this through the start of November. November 15th is the deadline for recommendations to be submitted. Once you guys get your recommendations in place, the stakeholder advisory group, which includes members of this group, our chairs, a couple of additional members of leadership, will be coming together to make sure that all recommendations fit together nicely. And we'll finalize those by November 15th. From there, it's going to go to a cabinet advisory. So members of secretaries of state agencies that are relevant for the plan will basically be saying, yes, this is actionable for me, or we think based on our experience, based on what's going on, that these edits should be included. And that's something that we'll investigate. And then once we have incorporated that, vetted our recommendations, we're going to be going into our public comment, which we'll create. We have various methods for that, and we can tell you more about that as we further develop our plan over the next month. And then in March and June, it goes to our state and federal leadership to review. This Longevity Ready Maryland plan is the state's multi-sector plan on aging, and it's also going to serve as the state's plan on aging, which is required by our federal funder as part of Older Americans Act. And then the plan becomes active. The final draft is available in July of 2025 and continues. The implementation stage is 10 years long, so it continues through 2035. Here you can look through about your roles and responsibilities. This is where you guys are, right? Develop the recommendations and provide supporting information related to our assigned goal and priority areas. And that tells you a little bit about the other folks that are part of this process. Our responsibilities are to identify and review the research, the data, the reports to inform our recommendations, to provide your expertise on identifying those objectives we should include. We want you to come to all meetings and prepare for them. We probably will have homework in the meantime. We're going to focus on solutions that benefit the health and well-being of all Marylanders as we age. So someone said, some of this is self-serving. It's self-serving for all of us, right? We're creating a system for all of us that are aging here in Maryland. And then we have a specific recommendations template. I'm just going to show it real quick to show you. We've got some guidance, some examples, and then you'll see we are asking folks in this group to develop 4 objectives and then up to 8 related strategies that include short, medium, and long-term goals. So it's very concise. It's going to be really hard for us. We really have to be focused. Here it has some measures of success. We want our goals to be measurable, specific, measurable, achievable, realistic, time-bound, inclusive, and equitable. We want to adopt inclusive approaches. We have a lot of focus on equity and inclusion, and we provide a definition for how we are defining equity. So please do take a look at that. And then we really want to build on, enhance, and refine existing strategic plans, services, community resources, and policies. Here's some of the meeting logistics, things we've already talked about, the streaming and the recording. We're going to have the meeting minutes, and we have timelines that we are held responsible to. And that's kind of our job to work with PZ to support that to get done. We have some meeting protocols here that we're hoping everyone can commit to, like removing distractions, speaking one at a time, demonstrating respect, and when possible, developing consensus. As I mentioned, we have our shared drive, and I kind of shared how that's functioning right now. There's not a lot in there now, but we imagine as we begin working, especially in maybe some subgroups, that we'll be able to use that as a way to work together in writing more effectively. All right, and then here's all our definitions. I'm going to make you dizzy for a moment just scrolling past these because I'm sure you're a little bit more familiar with them. And then the last area we have is informational resources. We have included state agency programs and initiatives so folks know where the starting point is, what resources the state already has in place. So please take a look at that. Really in our group, all of these are relevant because we're talking about how to collaborate more effectively, but some that might also be relevant for our other areas are really us at the Department of Aging. We have a Department of Service and Civic Innovation at the state that is really focused on volunteerism. We've got a library agency. A lot of folks don't know that. We think libraries can maybe play a really big part in some of the things we're talking about. And a variety of other organizations. So please do take a look at that. And then we have strategic plans and recommendations. So we've got a lot that are Maryland specific and then some that are national. And I wanted to point out a few things. Maryland specific, we've got the age-friendly strategic plans. We already have several communities in Maryland that have developed plans. On the national level, there's just a lot to build on. The HHS, the federal level, has put out a national plan on aging that we can pull from. There's lots of great information in Healthy People 2020. And down here, we have the Reframe Aging resources, which is a big component of thinking about ageism and how we can impact that within our group. And then we have research and data that can provide a good starting point for how we're doing so far to help us think through metrics. And finally, multi-sector plans for aging. A lot of states have done this already, and we can feel free to look at what they've done and figure out if we want to pull from there. That's all I'll share now. Oh, and I wanted to do that one more thing, right, Pazit? We wanted to share this slide really quick, sorry, just to remind us where we want to be. We can really get in the weeds, but as I shared, we're trying to be concise. So we want to make sure that we're cognizant of being having our recommendations really sit up here at this public policy level, which has an impact on all of the other levels. So we're really thinking through national, state, and local laws and regulations. We want to kind of focus in there as where we might have the greatest impact through our plan.
Maybe we can upload this image in our folders just to have maybe people want to review it later on, because I think it has a lot of good implications for us.
I'll do that.
Awesome. Thank you, Liz. So as you've seen, the resource packet is quite, I just want to appreciate the staff for putting it together. It is substantial and can keep you reading for many, many days. And I think for us, the role would be figuring out what are the most important reports and recommendations we can draw on. As Liz had said, we don't need to reinvent the wheel since there's already so much that has been written. The best thing we can do is figure out how do we want to prioritize our recommendations, what's already out there, so we can draw on that as well as our experience and then put something forward. So now we're going to talk about the kind of commitment to this group. I think that we already have received a couple of folks say, wait a minute, I didn't realize how much involved this work is. And I want to impress upon you the importance of recognizing the fact that you have been chosen and invited to participate in this group because you have so much to contribute, both in terms of personal and professional experiences. And we need you. We need your time and sweat equity, as we call it, in terms of attending the meetings, as well as doing the work in between, so that whenever we get together, we're most effective with our time. So just know that this fall season is going to be LRM heavy, and I hope that you can all stay with the process and communicate with us if there are any challenges that prevent you from doing so. There may be a point in time, and that could happen even later on in this meeting, where we will choose whether or not to stick with the 4-meeting format or have subgroups that convene in between meetings. This is really entirely up to us, and it depends on how pre-reading or pre-work is required before we can actually feel comfortable in articulating some of our priorities and goals. So that's something we'll get into in our next little session, item on the agenda. The third one is the communication between meetings. So we have our folders, and if you have not been able to access that Google Drive, it's imperative that you let Liz and Chelsea know, because that is going to be the way we can share our work products as well as communicate. I don't know, we don't need to say right now if you've been there or not, but Liz, do you want to show how the folder looks like so that if somebody goes in, they need to know what to expect when they go in? They haven't done so yet. And so while she does that, we're going to talk about communications via email. So I've already sent an email to everyone that is participating in this work group, inviting them to join and sharing the agenda. We can use that. You can reply all to that group if you have something of substance to share. But I recommend that we not have what we call work by emails. First of all, because we are supposed to meet in public forum, but also it's very difficult to track strings of emails. If you have something to share with the group that's substantial, just hold on to that until we meet, and then you can share that information. So just avoid too much work by email. It's not worked out well in past groups that I've been a part of. So I thought I would just suggest that as a rule of thumb for us before we plunge in and establish some good baseline for all of us. And I also want to, can I share my screen? Liz?
Yes, absolutely. Yeah.
We created a little suggested timeline. I think much of it will depend on the way we break into subgroups, but let me just share. Share. Can I share just one document? Window. There you go.
Should be able to. Yeah.
There you go. Got it. Okay, so this is a very tentative suggestion for the 4 sessions. This is the first one, the 13th. Oh, it should have been 9 there. I'll correct it in a second. So we talk about our process. We do a little brainstorm and how we want to focus our group, and we divide into subgroups. And the second one, the subgroups will report on the review of the resources and a discussion on what's missing and ideas for the direction for each group. And so you see that in the little asterisks, the subgroups will access the missing information, draft recommendation language. So the idea is for us to jump right in after reviewing existing resources and material we don't need to have a fully formed suggestion at that point, but we need to start what I call creating the clay and then mold the language we want out of that. And the third session, we would just do check-in after we had done some of the process. We look at the recommendation and make modification and update, as well as go back to the drawing board if there is any kind of points of contention. Very often at this point, there is issues, wait a minute, we didn't really think about that aspects and new information came to light. One of us has very strong opinions about the way we articulate it or the way we draft it. And then at the last meeting, we'll review the meeting. Can you please mute? Mute him, thank you. And so we can have a strategic choice to only meet the subgroups, only meet as a breakout session during our 4 assigned meetings. Or we can say we need the subgroups to spend more time, and it could be up to the different subgroups. So once we do our little breakout into subgroups and you will self-select into which group you want to be a part of, it is your prerogative to say we want more time in betweens. But that is a suggested timeline I think we need to stick to so that we can actually deliver on the last meeting and say, okay, we're all voting on it, or have a process we create and we say, this is something we want to work on. And I see a hand. I can't. Okay, stop sharing.
You have a meeting on 9/24. I have one on 9/30 and 10/24. I'm confused on the September 24th meeting. Did we move a meeting?
Don't know. I was just looking at my calendar based on what Liz is checking. So we're going to look at that. And so another question is this: we cannot accommodate individual people's time. If you have a doctor's appointment, we were not going to change everybody's schedule to accommodate yours. However, if this is something that I'd like to open for conversation right now. We have scheduled meetings for work day hours. If the vast majority of you, and I think Liz had sent a doodle survey, prefers evening hours, and the vast majority of you prefers that, we can switch it to evening hours to be more accommodating. We just want to make sure that you all have the greatest ability to participate. So yeah, so everybody has 9:30. My mistake. I must have like done some bad editing there. Liz, we can share the dates everywhere there. I apologize.
Put them in the chat.
Thank you. So have you seen the survey invitation to look at additional times of day? If you haven't, please go in and fill that out, and we will send an updated schedule based on input you provide in terms of whether morning or evening is preferable.
Actually, Pazit, that's just for the SAG so far, but we wanted to pose that question to the group. If anyone, or if the majority feel that they want some times that are outside of the 9 to 5 workday, we can do that. We can set up a poll while we're doing this and come back to it if you want.
Yeah, and we're not going to open this for conversation right now, but definitely consider the fact that this might be something that we would want to do. All right. Okay, so I think right now we're getting into the meat of things after giving a lot of intro and boundaries and line and structure. And the most important work we have to do this meeting is to look at the list of suggested focus areas put forth in the resource packet. And I think we can share the screen and show them again so that it is in front of everybody's eyes. And consider 2 questions. One is, what are the things you think are the most important? We can't encompass all of that. And the second is, are there things that you feel are important for us to include that are not there? In other words, when you read that list, you say, wait a minute, what about this, that, and the other? So we can open that in a conversation. So this is what we call a brainstorm session. There's no bad ideas. So just keep in mind that this is not about us trying to convince one another at this point. I just want us to start having a conversation and see where the group gravitates toward. And keep in mind that when we think about those priorities, that when Liz had shared that image, we're not looking, I'll give you an example. We talked about example. If let's say one of you really feels strongly about increased funding for mental health services for older adults at home, that is not the level of recommendation we're looking at. We're looking at things that are higher level that affects our larger systems and how they operate, how they interact with one another, whether it is state, county, nonprofit sector, for-profit sector. So can you all see the screen? Chuck, if you can raise your hand in the formal way, because that will help me manage and navigate everybody's raised hands. So if you have a hard time managing the raised hands, then you can get some technical assistance. So I'm going to look at the list of raised hands, and I see Israel first.
Yeah, one thing I see it reflected in the reducing disparities across the lifespan, but is there any way we can maybe focus on multi-generational aspects that kind of contribute to the longevity ecosystem? Because I know people tend to think of aging as this magic curtain that happens at 65 and older, but it's in fact, multi-generational, and coming from an aging in place background and other backgrounds, there's a lot of stuff that when you make adjustments for older adults or just people with disabilities, it impacts the entire family. So I just maybe see if we can bring in more generations. That's all.
It's a fantastic idea. I'm fully supportive of that. And I think what we can do, perhaps Israel, what we can do is look at the different focus area and consider equity and disparities and also the multi-generational aspect. So what does that mean when we focus on this particular area to the generations? Yep. Jane. Oh, sorry, Jane. Chuck. Yeah, I didn't mean to do that, Jack.
Get off that. Okay, one of the areas I think we have to address is isolation. And one of the solutions that I couldn't find very much reference to in the packet was transportation. I think that's a vital area for seniors. I think there's driving issues that Sean and I have dealt with, among other things. But getting seniors out of their homes to direct nonstop to a place where they want to go and back is vital, in my opinion, and I think we should address it.
Thank you, Chuck. So I think there is other group that talk about affordability, but we can think of things in terms of the charter of our group is an ecosystem. So how do we think about our systems, and we can have a transportation focused subgroup?
You know,
Jane.
I think that
Jane.
Thank you. So a couple of things I wanted to ask about. So I totally agree with Israel's conversation around intergenerational, because that's the summation of my 30 plus years of work. But one thing that is, there's limiters in the CMS regulations and in the health department and social services department for different kinds of care service opportunities. So if we're looking at a household, for example, like the Greenhouse Project or something like that, in terms of a model, when we look at models, part of the limitations, like when we look at renovating, say, a nursing home, and dementia is the topic, we'll just say that for example, in order to be able to renovate now, CMS has created a regulation that's created a lot of problems for doing any renovations for existing sites, right? So we used to be able to do interesting pods, interesting kinds of different settings that allowed people to be able to actually be more comfortable, have more privacy, all those things that we want for everyone to have. But I don't, like when you showed the public policy piece, the overlay, I was like, well, one of the public policy pieces really is getting the adoption of the Facility Guidelines Institute guidelines that have been written specifically to address different settings in long-term care. So that may be, because it becomes part of the licensing code in a lot of states, and it's not adopted here in Maryland. So that may be one thing. And then also, we've tried hard with that organization to try to lobby CMS for improvement without any, well, like, thank you, but no thank you kind of thing. So, but I wonder if there's not an opportunity there too, on the building side, to be supportive, because for us, it's a combination of the things that Israel was talking about and the transportation that Chuck was talking about, and combining that with the right living situation and whatever that may be, and the built environment, because that can then be supportive. So it kind of ties into the aging in place as well. But I think that that could be one thing in the bigger policy part that could be a consideration for a recommendation, because that's really policy action, I guess. And I hadn't really thought about it that way until she showed us that. Thanks. That was a little long-winded, but thank you.
I'm just going to clarify. I'm trying to understand. So your question is our prerogative in terms of what level of recommendation we should be making, and one of them could be lobbying with CMS, or are you looking, because I think that we can recognize what are the parameters of what our power is, and our power would be go to the state and tell them, here's what we're seeing elsewhere, here's good policies that you can enact to help make the work easier.
Yeah, I think it's two-pronged. One would be get Maryland to actually evaluate adopting the Facility Guidelines Institute guidelines, and I'm happy to share or do whatever you need for that. I wrote that 2014, and it's been updated, and it's working on 2026 right now. But the disappointment we had in that I think it was the 2016 and then through 2019 rulings in CMS is they wouldn't accept the guidelines, in addition to limiting the size of the rooms and having them accessible for the bathroom part. And that limited us to who we could care for. So it stopped and halted a lot of really good renovation projects that could actually make quality of life better, more privacy, less isolation, all those kind of things, but it limited that opportunity to do so. So it's two-pronged. Yeah, thank you.
Yep. Linda.
Yeah, I wonder where existing systems of that have an ecosystem, and I'm thinking specifically of the Department of Veterans Affairs, that has a parallel system of care for veterans as they get older, and their perspective is uniquely in that they don't wait till somebody is 65 and magically drop stuff on them, because many veterans need assistance from an earlier age because of disability, of service-related disability. So thinking not just as people who are older need things, I was hoping that we would start to plan for people earlier in the lifespan, building houses that they can age in from the get-go, building communities that they can thrive in from the beginning, not waiting till they're 65 and then trying to plug a square person into a round hole.
So looking at the VA system as potentially an inspiration for a suggested system overhaul in the way that system interact with one another. So if you have any resources for that, Linda, you can share that and we can upload that so people can look as well and assess the relevance of it and what can be drawn from that. Catherine.
Thank you. One of the things I did in preparation for this meeting today, which really helped me sort of qualify and maybe quantify some of my ideas, there was a list of multi-sector plans for aging in a variety of states, including California, North Carolina, Texas, Oklahoma, New York. And when I reviewed those multi-sector plans that people were building, again, an aging master plan, majority looked at really social determinants of health, which would encompass bring in Charles's transportation issues and would really address the equity, inclusion, and belonging issues. I mean, when I looked at that, and it was kind of universal with all the states, he didn't call them necessarily social determinants of health, but that's where they would land. And I thought that was an important perspective as other states who have gone before us. But what I also, to Jane's point, thought was very interesting, in Vermont, they've had some of this then codified so that you had some power behind this longevity ecosystem, because I really appreciate, let's look policy-wise, because at the end of the day, you're only as good as what those legislators pass and agree to. And so I think having a North Star about, if that is in fact MDOA's interest in North Star, that you want this plan and see that what can be legislated, that people agree to. And so to Israel's point, looking at it, aging in general in Maryland, that it's not, while we're interested certainly in older adults, but it really could apply to anybody in Maryland. I don't know, just again, taking some broad brushstrokes at what some of those resources in other states who have kind of gone a little bit further along maybe than we are. That is kind of what I gleaned from looking at all of those. Some of them actually went into all ages and all stages, particularly in North Carolina. It was really rather interesting, but certainly their main focus was social determinants of health, which really is cast a wide net, and looking at moving to what could you get codified. Just my perspective on that.
Yeah, I love the way we're taking this conversation. I think this is the level we're all aspiring to. So we're like-minded people in that sense. And I think what we could do with the help of our staff is to identify the kind of thing, because our purview is working on the ecosystem, on the structures that can then support longevity-ready activities. And then, for example, housing, or we should look at other groups and see what are they working in terms of supporting policies for affordable housing or transportation. So we'll have to stay in close contact with other groups to make sure that we say, okay, they're taking care of that component. We can then focus our attention on something else. So I definitely see this as a constant communication imperative. Marcia.
A couple of things I want to first back what Charles said. The Commission on Aging recently in Montgomery County has launched a program to get out in the community and talk about programs and services that are currently available that nobody knows about. And very few people, when we go out and do these presentations, They just don't know it's there. And that leads me to sort of a broader overall, and I don't know how this is accomplished, but I think we have to keep in mind communication of how people find out about all of these things. There probably are a lot of wonderful systems in place. Would love to see them made into policy. But people have to know about them. And that includes, as whoever just mentioned, multi-generation, the children of older people.
Awesome. Marie?
Okay, I've written down 5, but I first want to second what someone said about social isolation and transportation. That's something I'm thinking about all the time. The ones I've written down about adding, I think one is since the goal is to work towards having a more connected ecosystem, I think part of it needs to be, as an early step, identifying what the barriers are right now. Like, why are certain pieces not connected to each other? Are there reasons that come out of, you know, legal considerations? Like, some organizations are prevented from doing certain types of things. Like, why isn't it more connected now? And then 2 is, I think that it's important to have better ways to collect public input and data about what older adults in a given community need and are lacking, and being able to do that in a way that's maybe not assuming there's uniformity across the state, but in a way that people can easily, you know, express that in their, you know, circumstance, there's something that they need that they're not getting. And making it feel simpler for people. Then I also wrote down the communication point. Like, even if this plan goes perfectly and the ecosystem, you know, becomes a perfect solution, if people don't know how they can access parts of it, then it's not helpful. Then also kind of thinking about it as helping people plan over time, like what they can start thinking about in advance, because something we hear a lot is people run into a problem and then it's an emergency and then it's hard to figure everything out on the spot. Instead, getting people more familiarized in advance with what they might need and what they might want to start thinking about. And then the last thing I wrote down is and I know that there's a component here about working with the private sector. I think that some of this needs to entail figuring out what incentives there will be for the private sector to change and to make certain decisions that will fall in alignment with this. Yeah.
I would add public sector as well. They need incentives to change too, and you know, we do need to look at those. So thank you, Marie. So I'm just gonna, before I turn to the other 4 hands that are up, just a structure issue. The ultimate goal for us is, after this brainstorm session, is to have a couple of subjects that we might choose to prioritize. And I don't know if, Liz, if we can share a little whiteboard where you can write, because I'm hearing multi-generational or sort of cross-generational planning. I'm hearing communications come up again, so barriers to that, and looking at transportation as a focus area. So I want to be able to, at the end of this conversation, to have a list of subjects and see if we'll gravitate towards some and not the others. So then we can then use that as our subgroup focus areas. So just want to interject that. Israel, go ahead.
Word document, but I'll try to pull up a whiteboard now as you guys.
Okay. Yeah, because I think I want to visualize that, because so much has come up and I want to be able to look at it and say, okay, this is interesting. Maybe I want to sit in that one. This is really cool. So maybe we can even articulate with words like, we're going to talk about the policy areas: supportive and inclusive communities, ageism, and elder abuse, and then see how we are with our subject focus. Israel, go ahead.
Sorry, one point I wanted to make was I had to make a call, so maybe you guys talked about it, about language. Sometimes you see seniors, sometimes you see elders, elderly, older Americans, older adults. I think, I mean, from what I've seen, people prefer older adults, but yeah, of course, with certain other words, stigma comes with that. And also, is the goal to refer to like I know HHS has a national framework on aging, but then there's also different county tools and state tools. So it's kind of hard when you get so many different frameworks, and then you have what is it, the Hartford Foundation, has like the 4, the 5M. So maybe trying to figure out what's true north and how do we all make sure we're not doing too many different frameworks and things like that. But I think language is important. That's all my main point.
Actually, you're saying two things. One is that refers to the focus area suggested around ageism. So how do we talk about aging? It's funny, I thought you were going to say, oh, all the different languages people speak and how do we create a communication plan around that? But that's just a side note.
Yeah, I mean,
but also what you
that-
just said,
yeah.
the other comment is, we'll get there, I hope. But I think that's why this work is going to be so intense. It's not just about us freewheeling ideas. We do need to go back, do our homework, and read what's out there so we can cherry pick whether it is listed on a county policy or another state or even national or another veterans context. So we have our work cut out for us because we don't want to reinvent the wheel, and there's so much out there. We need to digest all this information and distill that into a recommendation we think will be viable. So that's why this is really intense. You're touching on the core of the difficulty we're faced with. First would be, how do we prioritize? Because people have different passions and there's lots to do. And then secondly, how do we then create meaningful recommendations that we feel would be impactful? Jane.
So much has been discussed. I got to see if I still have my question and my thread of my thoughts. When we go through it, the people and services, it was what Marie was talking about in terms of the division. I always thought about it because it's like services over here and people are kind of over here. And so that working together for the interim of the communication also includes who has the service. It's a little bit of what we talked about on the introduction call of who's providing the service and how many different agencies may be providing a similar service, and then who's funding that service, because we find that duplication is part of the problem, because then we're not identifying some of the gaps that might be ignored altogether. So there might not be a good gap filler for transportation, but there's one for food, but this hand doesn't know what the left hand's doing, even though both are good programs. So to me, that having that either a database or a listing, and the hardest part of any database work is keeping it updated so it's current. Because I agree with that. I also agree with the nomenclature of what Israel is talking about, because I've found older adults seems to be the preference. We thought elderly or elders was respectful, but have found that that's not necessarily taken very well. So we've also looked at aging as longevity as another terminology, because we've had the same issue around that. Thanks.
Yes, Jen, I just want to refer to some of the things you said. There's something, I hear something more. So there are two things about the system. I call it system integration. There is a public facing system integration where we have one-stop shop where you can find all you need and you can learn about this, and the other. And we also can look at system integration on the system back end and find out ways if we can make recommendations to make our system less fragmented, so that it doesn't have to create, we don't have to create such complex databases that constantly need to be updated. Because, I mean, that would be something that I'd be really excited about if we create meaningful recommendation to reduce the fragmentation of our systems of delivery across the generation. Linda.
As you know, at least in the Montgomery County Commission on Aging, one of the things that vexes us is the lack of manpower, person power to deliver services, whether it's in the home or in a facility or somewhere else in the community. And so workforce development has to be part of this. We don't have enough people with the right training coming out to support people as they age across many different circumstances. But I'd also like to to tack onto the communication issue, I see this as knowledge management. We have the knowledge, consumers don't. Maybe we don't have the knowledge, but knowledge management in terms of how available services and eligibility kinds of decisions are communicated to potential users, but also knowledge of aging, the aging process, what older people need, and communicating that to potential students, doctors, nurses, CNAs, social workers, physical therapists, all of those things. So the broader spectrum of knowledge management, information, how it's conveyed, and making sure that we have enough people to do the work on either side of the knowledge management spectrum.
Pizzy, did you say me?
Yes, I say you.
Okay. Gosh, this conversation's been fantastic. Really wonderful. Everyone has great angles. I would just say one tiny thing, just FYI, I did notice the transportation is alluded to under the Optimized Health, Wellness, Mobility work group. So when we're getting into more detailed things about transportation, it might be more appropriate for that work group. But in terms of this one, I think looking at data collection, deciding what kinds of population level data that we really want to track, whether it's percentage of the people who are experiencing food insecurity or who are housing cost burdened, what is their lifespan based on categories of ethnicity, to this point about longevity and social determinants of health, things like trips to the ER based on falls. Maybe we play a role in determining what are the things that we're tracking, and you could get overwhelmed with all the things you potentially could, but this group with the biggest picture forest view maybe ought to prioritize some of that data point. So thank you.
Well, I think it's really one of the recommendations that can come out of this is a requirement to collect the data on a systems level. So they can say, we expect the state, we would like the state to be able to create, Linda had said, predictive models. We need to have a constant and consistent way of compiling data from different sources to then help us inform and assess. So this is baseline, how are we moving forward? And for that, we need to see what's already being collected, because I alluded to the fragmentation. I'm assuming there's different organizations that collect different types of data, but they're all stored and owned by one or two entities. And a good recommendation for us would be, we want them to talk. Not only to talk, we want them to be able to compile things in a meaningful way so that we can see the big picture. So that would be an interesting focus for us. Kathy.
Yes. So if I stand back and think about all these things in the situations that I've been in, which have been very multi-generational, we have, to me, a real big competition here. We have talked ourselves into senior living communities and, at multiple levels, in that's really such a great thing. And even though folks may want to live in age in place, they say, oh, this has got to be better there. And then when they get there, they realize that they've lost connection to the rest of the world. And I have people who've been in both, family who's been in, and friends who've been in both. One of the things that I think we have lost is this sense of community. My parents in their mid-90s are in the same community they've been for the last 70 years. And I don't have to be there every day or every minute of the day, because they have neighbors. They have neighbors who will take them somewhere. They have neighbors who check on them every morning. And that sort of ecosystem, I believe, is, I think, what we're looking for, which doesn't take away the need for the people to do health and support and the workforce development training you were talking about, and etc. But what it says is, how do we re-energize our communities? A perfect example of this is, I work with a land trust that's in the urban areas of Baltimore County. We have now been able to put a pocket park in about 20 communities, such that this is a place that people can walk to, communicate with, say, hey, have you seen Mrs. Smith lately? Have you seen such and such? We haven't seen them. Let's go check on them. It gives a place for people, you know, even with different abilities to be able to walk and do their exercise. So I would like to add open space and community engagement in this way. And these are also spaces where we could host more health bazaars or aging conversations. And our community organizations have that capability. And that's one of the things this land trust does, is it really helps build more, the community organization helps them build more strength and more topics.
I love this perspective. I think that talking about how we think about, when we talk about ecosystem, there is the ecosystem of the policy and the large state organizations and agencies that deliver services. And then there's the ecosystem on the scope of what's happening in local communities, or how we interact with municipalities, with civic association, with land trusts, with other entities that are local and understand the needs of the community. So a good focus group could be, how do we make recommendations that develop infrastructure to support those local-based community organization to build their infrastructure. That actually builds on the multi-generational focus. So I'm seeing some connections there as well. And
Pazit, really quick, I just want to do a time check. We got about 20 minutes left.
we're gonna sit here all day, everybody. You didn't know it, but we are gonna do a day-long retreat. I'm sorry I didn't tell you ahead of time. Yeah, so thank you, Liz. I will, after Ann and Chuck, we're going to, Chuck, and if you can just like quick one, because I want to be able to respect everybody's time and make some, hold on, Chuck.
Briefly.
Ann first Ann, and then you. I'm going by order. Go ahead, Ann.
So to go back on the data collection subject, is anyone in the state using AI or piloting AI? Because I think it might be a good case study or use case for collecting interagency and local and state information. And I worked with CMS and data, and CMS has massive databases that they work with research institutes, universities, and insurance companies, and other social service agencies to connect dots on outcomes that are social determinants of health and longevity. So we may be able to, to tap into some of that data. But if there are state resources, it would also be useful to either get some of that expertise or access. And then just finally, as we go into next steps, there's a lot of documentation to get through. Perhaps we can have some sort of summarization format so we can share that information, because I know I can't read every single word of every document, you know, so that we have a place to go and review what other folks have gleaned from their respective readings. And I'm done.
So maybe we can have folks, part of our homework would be to go out, find those critical points, see if it's not mentioned in the resource packet, and then upload that in our documents as part of the work. Yep. Chuck.
Yeah, I think we have to work on focusing. I'm getting a shotgun approach to our discussion, which is good, but we're getting to be generalists, and I think in a sense we have to kind of narrow the scope of our activities. We have a limited amount of time, few meetings, and I'd like to see a little more specificity. That's it.
So so I agree with you that so far we've done a brainstorm session, because before we go to the particular subgroups and our focus areas, we needed to see, okay, where is everybody's minds are? What are we seeing that are large trends? And the specificity is not going to necessarily be add more buses on after hours, but it would be specificity around the subject we're going to have our work groups focus on. So I think that right now, the best thing to do is, I don't know, we were talking about doing a little bit of polling. We've brought up a lot of different subjects. Some of them are already mentioned in the resource packet. Others, and I love some of these recommendations, all of them, I love for us to look at some of these recommendations as suggested subgroup. Because process-wise, we've done a lot of rambling, which I think is really important. And now we're going to start, like Chuck had said, we're going to say, okay, we have all these different ideas for focus areas. We have limited time, limited manpower, women power, people power, and where are we going to put our weight, time, and energy? And so I think we need to do a little bit of a voting, or polling, or checking of the pulse, so that you can say, okay, of all the things that have come up, I'd like to put my weight behind this subject. And so I don't know, Liz, if we can do this polling. If it's not possible in live, and especially since a couple of you were unable, people who were unable to attend or had left the meeting already, what we're going to do is we're going to just check the pulse of where you want to put your effort into. And we're going to have a little voting process where we say, I want to put my weight behind multi-generational or communications, systems integration, connection to the community. These are the things that I wrote down, but I think Liz had written so much more. And we are going to do the hard work of focusing. And that is going to be painful. And you might not be totally happy with the things that we choose, but this is what working in a group means, that you're going to have to join in whatever the majority is more interested in focusing, knowing full well that maybe this is going to be phase one, and maybe there will be a LRM take two. We've accomplished, checked off all these awesome recommendations, and we can revisit and then take another stab at this work. So Liz, are you checking in with you? Do you want to do the? Sorry,
yeah, I
ahead,
haven't set up a poll. Chelsea, have you been setting up a poll as we go?
That's what I'm doing. What I'm going to do is take the main points, the multi-generational communities, addressing social, and that's how we're going to do the poll.
Okay.
So we're taking the broad topics. Liz, if you want to keep this session or this page open, I think that would be awesome. So
Okay. Does it make sense to do that, or should we just raise our hands this first time and get a little more familiar with polling next time?
Or we can do a doodle poll.
I don't want to. We only have like 10 minutes, so I don't want to spend time setting something up. What do you think, Pazita, about just having people raise their hands? We'll do a quick count this time around.
For each of the subject?
Yeah. So what I did is, as we had this conversation, I tried to pull out these main topics and put them into areas. I think a lot of these are cross-cutting areas, right?
What I think would be interesting is if we just do hand raising, people are going to have to do some thinking. And here's our like quickly thinking about a suggested modification. Since we're going to have a few work groups, we're not going to have just one. We're not choosing one topic. You would actually need to consider top 4 or 5 priorities. This kind of echoes Linda and Jack, the way the Commission on Aging to make their priority for budget priorities, right? So you need to think about what we've said. We will send a follow-up survey where you would be asked to look at the different subject and vote of 4 or 5. We'll think about that because there's about 20 of us. And so every work group should have something between 3 and 4 people doing the work, at least, because there's so much to do. So we're going to choose those areas. And the next time we meet, we're going to do things sort of in terms of in between. You need to look at the areas that we've brainstormed. You're going to make your vote 4 or 5. And you're also going to say to us which once we send the results, you will then tell us which work group you want to be assigned to. There may be some shifting around just to balance participation across the different work groups. And then in the next session, what we're going to do is create breakout session for the work group to sit down together and begin to develop their question. Okay, what information is missing? What are the things we're beginning to see as top shiny object to latch onto that we want to start working on? And then start to develop some ideas on where we're going to take this. That's my suggested structure. And we do need to consider the question of, do you want to meet in your subgroup in between sessions? So perhaps there will be some email communications ahead of time, because I completely see a scenario where between now and the next meeting, we vote, we have our work groups, you are assigned to a work group, and if we're going to have a lead to each group, and that lead can initiate a meeting before our next session, just as a prep session. So just know that you might need to be asked to do that if you can. Go ahead, Chelsea.
So I had the poll set up if you just want to do a quick one.
If we can, I just didn't want to stress anybody out. So the poll would allow people to vote for more than one. They can have 4 priorities.
So
Let's
to
see
get
how
to
it
the
goes.
poll, I
Yep.
believe you have to click on the activities button, which is the 3 little shapes on the bottom right, and then go to poll, and then you can respond to the poll there.
The 3 dots does not bring me to a poll.
Not the 3 dots, the 3 shapes. So
On the far
second,
right, it looks like
Okay.
a triangle, a square, and a
Yeah.
circle.
Okay, the bottom left, bottom right in your screen, poll.
Marie, do you have a question?
Yeah, did you intend to make it possible to select multiple?
Yeah, that was my question.
Because right now there's only one.
And I need to select more than one.
Yeah. Plus, I think there's more than 5. 1, 2, 3, 4, 5, 6. I think there are some issues that were mentioned in the packet as a resource. So we had, I think we probably should have them mentioned as well, since they were in the resource packet. And perhaps people have suggested additional things, assuming we will also address these issues as well as part of our group. So the elder justice, building local community capacity. Catherine, go ahead. You're on mute.
Pardon me, I already voted because I'm a big proponent of social determinants of health because it does incorporate lots of this under one topic. That has great amount of data, whether it's CMS, health department, there's a lot of great data about this. But anyway, so I already voted once. So if you're giving us opportunities to vote again, I would probably need to.
Yeah, I think we should work on a more clearly articulated poll, so that would allow you all to look at all the options and choose 4 or 5 of them.
And
I
Pizzy,
don't wanna rush.
we can't from this pull out what people's preferences are. So I think we're going to need to. This is like a pulse check. How's the whole group feel? So I think we can do that now, but we'll have to follow up to be able to place people into groups as you described. And I think the process you talked about was fantastic.
Well, I don't know if I can vote again, but I already at least voted once.
I think we would ask everybody to vote again, because you will be asked to add additional priorities, so that we have like a good firm sense of the consensus we can build.
Perfect. Thank you.
Chuck, you're on mute. Chuck, you're on mute. Chuck, you are on mute.
I got it. I'm confused. I'm technologically hampered. We're supposed to go to this activities program. Is
No,
that correct?
don't worry about that right now. We're going to send you a link to a more structured voting tool, in which you will see the entire list of priorities we have suggested, and you will be asked to pick 4 or 5, let's say 5, just we'll see how much we go of them. So that would help us create our subgroups moving forward.
When is this going to happen?
As soon as we can finagle that from the back end, we're with
And
the
not
MDOE.
today, not at this meeting.
No, I think that there is a lot to prep to create a really good voting tool for us to be meaningful. So again, to recap, you will get this voting, you will be asked to look at the list and give some thought, some time thinking, maybe ask other folks what they think. If you have good peers to consult, make your pick, take your pick. And also note in that tool, which group, we'll do 2-step. First voting, and then we will share with you what are the things that rose to the top in people's mind. And you will be asked to assign yourself to a group you want to be a part of. And then there will also be a lead. So in between now and the next meeting, we'll have vote, group, subgroup, lead, and the subgroup can then choose to meet in between. So you will receive communications from your lead saying, hey, if you guys are up for it, here's a little doodle poll. Let's get together for a brainstorm session to decide how we want to start working. If you can get that done, don't worry about it. Our next session will primarily focus on our breakouts and our ability to then create a good work structure for our subgroup to then begin develop what's missing, what do we need to learn up on, begin to develop the sort of actionable but also long, medium, and short-term range goals, so then we can get the ball rolling. I will say one more thing. I think it's possible that you might want to invite an expert speaker. Let's say, okay, my God, somebody says, oh, this researcher had done this tremendous work. Maybe we can pick their brain. That can happen as well. Or you can say, everybody in this subgroup must read the sector planning for California, because that would serve as our foundation. So if you haven't read up on it, you can't really meaningfully participate in the subgroup work. So just be ready for a lot of drinking from the fire hose so that you can absorb enough information and distill it into something meaningful. So your biggest task is really learn up as much as you can on the subject you'd be focused on between now and the next subgroup meeting. Does that make sense? I'm getting nods. Okay, good. I like nods. Shakes are good too. Okay, one more thing I want to say. In terms of meta conversation, if there's some really strong opposition, I get the vibe from you that you are very comfortable about saying what you think, and that's what we need. Don't be afraid of being a contrarian. Somebody's like, wait a minute, what about this? Oh, I'm not sure about that, because we can definitely integrate some of these divergent opinions into something more meaningful. The last thing we need is what we call groupthink, where everybody thinks, oh, we're all so wonderful, we're all agreeing in the same thing, but we're missing. So when you think about diversity and inclusion, I also want to think about diversity of opinions, of ideas, of perspectives, because that's where we're going to get the gold from this. Jane.
So you're okay if we reach out to like other agencies we've been working with or anything like that? And can we reach out to one another? Because I want to talk to you guys about the land trust comment and what Catherine's been doing. I mean, I'm surprised we haven't run across each other in our work. You know what I mean? One of those, but I think I just met my new people.
Well, the contact list exists, and feel free to reach out to one another for offline conversation that can possibly then feed some of the work that the work group done and say, okay, we had this like side conversation, and then here we want to bring this to you all, and here's some of our ideas that we've generated. So I think that's going to make it a richer experience for all of us. And relationships is, we're building community right now, and ecosystem are being developed as we speak here. All right, so that's been so much fun.
Thank you.
Thank you.
Thank you.
Thank you. Thank you, everyone. You will get some follow-up emails. Please, show up. I mean, we need you to really show up and do the work. Otherwise, we can't really make meaningful recommendation to the state on this.
Do we have, or will we get the packet that was of the slides that today?
Well, you should have had access to this already, so call the staff to get some technical assistance. It's critical that you know exactly where everything is, because otherwise you won't be able to be a part of this work group. So make sure that you know exactly where everything is and that you're comfortable using those systems.
Yeah. Ronald, I'll follow up with you via email. In just the last minute we have, Pazit, do you want me to walk through the folder really quick?
Yes, I think we did that in the beginning of the meeting, but Ronald, pay special attention to how things need to look from your end. So I know I had some challenges with having to establish a Gmail account specific to this work, because know that you might need to Gmail there. They tend to do things their way. So if you don't have a Gmail account, you might not have full access to everything that is already in the folder. And that's something I had to work out with my IT.
So just really quick in the last minute, because I didn't end up pulling this up, but this is, so you should have gotten the packet from us via email when we communicated about the upcoming meetings. You'll see it as an attachment, and I'll make sure that everyone was on that list. When we get into, so when you click on within your packet, those quick links, it gets us into this larger public folder. This is where all of the reports and data that we already have compiled can be found. You should be able to see all of these. So they're linked within the packet and they're all here. We can put additional things in here, or we can put things into your specific folder. Here's the work group folders down here. And here we are building a longevity ecosystem. When you come in here, this is what you should be able to see: a contact list and 2 folders, working documents and final documents. This final documents is everything that members of the public can see. It's our agendas and our meeting minutes that are complete and ready for consumption. And then the working documents are things that we are going to collaborate on. So for example, if your work groups, once we establish them, these sort of subgroups, want to have working documents where you're doing your brainstorm or you're starting to draft out things, you'll be able to put those in there. Right now, you'll be able to see the introductory document in there. And I'm also going to be putting in the brainstorm from today that has our notes, just so everybody can reflect on that. And we'll be adding to it as we go. So that's the structure there.
And we can add documents ourselves. We don't have to go through you and Chelsea or Physique.
Yes.
And
just a word to the wise: don't put anything in here that you don't want other people to be able to see, because we have to do the transparency thing.
And
yeah, I just want us comment. I think that there are some of you that are very vocal and some that are a bit more reserved. I do want to hear from everyone. So maybe next time I will make an intentional effort reaching out to folks. So don't be taken aback if I say, "Oh, Ronald, I haven't heard a word you had to say. Where is your mind here?" Because we need your perspective as well as everybody else says. So just make sure that we're all thoughtful with giving everybody else's time to say what they have to say.
I just want to say thank you so much both to Pazit and Liz and Chelsea, but also everyone. It's been wonderful to meet you, and I think super interesting conversation, even this introductory one. So I'm really looking forward to it.
You made my Friday, let me tell you. I'm with Marie.
Take care, everybody.
There's a party at the end. We'll have save the day. We're going to get together. Happy hour someplace in Annapolis on the ocean front, on the beach front.
Yeah. Take care.
All righty.
I have a park we can host. I have a park we can host the party at.
All right, there you go.
Baltimore. All right, take care, guys.
Thanks.
Thank you.
Bye, everyone.
Bye.